session. We are live on YouTube, and I would love to hear from you. Please give us a quick hi, hello, and we can see whether you are able to see us, whether you are able to hear us. Please send in a message here. Are we audible? Okay. Okay, great. So I'll just see where the chat messages. Where do I see the chat messages? I can't seem to find out the chat messages. Just a second. Let's go full screen. But it will not show me the chat messages. Where are the chats? Okay, live chat. Why are the chats not visible? Okay, yeah, I can see now. Good evening, everyone. Good evening, Pragya. Good evening, Vanshu. And hello, and welcome to this session today. Today we are going to be talking about biochemistry for first-year students. So if you are a first-year MBBS student, this session is for you. This session is exclusively for our first-year MBBS students, and how to handle biochemistry, how to prepare for biochemistry in your first year. This is what we are going to be discussing today. Okay, so first and foremost, although you have heard this previously, I would say welcome to the medical fraternity. You are now a part of a well-connected fraternity, the medical fraternity. You're going to be our future doctors, and welcome to this noble profession. But सबसे important, शुरू में बोल रहा हूँ, it's a long way. It's a long way, and you have to be prepared for the long haul, and you cannot take it easy. So this is a difficult journey, but a very fulfilling journey. It becomes enjoyable if you give some effort from your side. अपनी तरफ से थोड़ा सा आप effort डालेंगे, then it becomes very enjoyable, because if you are able to understand things, then you like them more. If you're not able to understand things, it becomes irritating and frustrating. You will be able to understand things if you put in a little bit of effort right from the beginning, which is now. So right from the beginning, if you are devoting a little bit of time regularly, then that's the first thing where you can make good headway. Okay, regarding biochemistry, a few important questions which we generally get. If you have some questions, you can definitely drop them in the chat, and I'll take them up. But the first and foremost question is, sir, kahan se padhe? From where to study the biochemistry? Okay, so there's no perfect, or I would say there's no really correct, the very correct single answer to this question, kahan se padhe? That is a common and straightforward question. So for this, I would say you should stick to Indian authors as your primary textbook. And I know this will be told to you by all the faculties and your seniors. Indian authors are a good point of starting material. They will not be a reference material, but the stock, the main thing that will be using for studying. So that has to be the Indian authors. The top two books will be by Dr. Dinesh Puri, textbook of biochemistry by Dr. Dinesh Puri, and the second is by Dr. Vasudevan. These are the two primary books that you can choose to use. Visit the library, take a look, and see which one suits you more. see, the book by Dr. Vasudevan has been around for a long time, and it has a definite structure, but I would say it a little bit dry. Dr. Dinesh Puri's book is one of the books which is used as a standard textbook by NMC. NMC recommends using the book of Dr. Dinesh Puri. It is very, very lucid. It has a very unique flow of the information, and it is a very interesting read. It has a different take on approaching the biochemistry, which makes it easier to understand, easier to follow, easier to retain. But like I said, everyone doesn't have the same approach to remembering things. So I would recommend take a look at both. Read one small topic, same topic from both the books, and whichever is more useful to you, whichever you think is more understandable to you, that is the one you should be using. So either Dr. Dinesh Puri's book or Dr. Vasudevan's book. This should be your primary. This should be your primary uh, book or your regular reading. So when you are going for the class, you can do a quick reading from this book before you go for the class, and you can complement your notes from the content given from in these books, any of the two books which you use. Okay, but please keep in mind that a lot of time there will be some discussions, or there will be some questions which you might not find in these books. So a very, very important reference book. Your primary reference book has to be Harper's without any doubt. The Harper's Illustrated Biochemistry. This is your primary reference book. Currently, we have the 32nd edition of Harper, which is available. For Dr. Vasudevan, it would be the 8th edition. For Dr. Puri, it would be the 4th edition. I think the 5th one is about to come. I'm not very sure. So these are the books which you should be referring. Okay, so once you know about the books, the second approach for your university is please attend the discussions. See, in your first year, you have early clinical exposure and you have small group discussions. So these are very, very vital, because unlike your seniors who used to have very you can say boring linear type of questions, now for you, most of the faculty prefer to give clinical scenarios and then they build on the knowledge. Okay, so unless you participate in these clinical exposures, the small group discussions, it will be very difficult to tie the things together. जो कुछ भी आप पढ़ रहे हैं सबको एक साथ जोड़ना, उसके लिए it is very, very important that you attend these two sessions, the small group discussion and the early clinical exposure sessions, where we are talking about the clinical cases. So if you attend these two, then your paper is likely to be a cakewalk. The third very, very important thing, which a lot of time we can ignore, is look at the previous year's papers. Now, this is very, very, very important. Okay, look at the previous year's papers. Why I tell you this will help you in two ways. This will help you in two ways. And number one, it will let you know what type of questions, which topics are important for your exam. If you look at last 3 or 4 or 5 years, you can quickly get an idea. Okay, these topics are very, very important. Oh, this topic is not being asked at all. Because if you look at the book alone, everything looks important. Whatever is in the book is probably important. That is why it is in the book. But looking at the previous year's papers gives you an idea that which topics are being asked more frequently, which topics are being asked less frequently. Okay. And for this, please remember, don't wait for the end of the year कि साल के आखिरी में ना मैं पेपर्स खोल के देख लूंगा, जो जो क्वेश्चंस आए बस उनको बना लूंगा. नहीं, it will not work that way. If you wait for the end of the year, then the boat has already sailed away. When one of the topics is covered, let's say carbohydrates is covered, so you should quickly look up the papers and look what are the topics being asked in carbohydrates. Okay, and here it becomes important to see the previous papers, because you will get to know कौन सा topic long question के form में पूछा जाता है, कौन सा topic small topic के form में पूछा जाता है. So until you know which topics are being asked as the long question, which topics are being asked as small questions, your preparation will not be complete. Okay, because now when you know that, okay, the classification of carbohydrates or the properties of the biochemistry of the carbohydrates is going to be long question, then you can prepare the content in that manner only. You will try drawing the flow charts, you will try identifying the specific examples which you're going to write in the answer. You can identify the test which will be used for describing each of the monosaccharide, the disaccharide, the polysaccharide. But wherever only the small note is required, you need not go into so much detail when you're preparing the topic. So looking at the previous year's papers, this will help to very well summarize and streamline your preparation. Do not underestimate the importance of the previous year's papers. This will give a very nice and simple framework for you to do your preparation. But only thing is, don't wait for the end of the year and then open the question bank. Once the topic is covered, then you have to look at the question bank and summarize that content at the same time. One very important thing which people might not tell you, or they might forget to tell you, is that you also need to solve MCQs. All the papers are going to have some MCQs which you need to solve. About 15 to 20 MCQs will be there in the paper. So along with reading the theory, you must also solve the MCQs. Now, if you look at the platform through which this video is going out to you on the DocTutorials, we have a very good question bank with appropriate explanation, which is all created by the faculty itself, whether it is first year or second year or third year or fourth year. So I think it will be very useful for you to look at the questions from the topic which has been covered. It will serve two purposes. One, you'll get to practice the MCQs. Very, very important. You're going to get 20 MCQs in each paper, paper one as well as paper two. Okay. Second, with the MCQs, there's some explanation. So explanation will tie the information of the MCQ with lot of other applied aspects of that topic. So it gives you an insight about the question, about the topic. And if the question is approached in a clinical manner, then also you are able to handle it. Okay. So like that, you have to make sure that you're solving the MCQs along with the chapters when you're reading it. Again, I will repeat what I said for the previous year's papers. Don't wait for the end of the year to start solving the MCQs. Once the topic is done, you can open the app and you can go to that section where the questions are segregated section wise, and you can quickly solve the MCQs from that section within the app, right? So that will help you to reinforce whatever you have read in the class. You might find some questions or topics we not discussed in the class, so you can quickly add them in your notes, which will complement and supplement your notes that you have made in the class. And later on, when you revise, you're revising the notes, so you're revising what was covered in the class. You are revising what was there in your book, and you are also covering the questions in the form of the MCQs, which will be in there. Okay. So I have a guest here who has a message for you. Please come here. So this is something which I said right in the beginning also. Okay. So this is my daughter, and she is going to give you a message which I said in the beginning itself. So you can say hi, and you can be loud. Be loud. Hi. Okay, so she is very interested in some motivational shlokas, and she has offered to speak a simple motivational shlok for you, which will help you in keeping you on a track. All yours. उद्यमेनि सिद्ध्यन्ति कार्याणि न मनोरथे न हि सुप्तस्य सिंहस्य प्रविशन्ति मुखे मृगा. अर्थात परिश्रम करने से कार्य सिद्ध होता है, केवल मन की इच्छा करने से नहीं. जैसे कि सोए हुए शेर के मुंह में हिरन अपने आप प्रवेश नहीं करता. Those who are not very comfortable with Hindi, this means that only when you do hard work, you're going to get results. Just by thinking about the results, you'll not get the results. Just like a sleeping lion doesn't get the deer walking into its mouth on its own, the lion also has to go and hunt for the deer before it can eat the deer. Okay, so thank you, Anji, thank you very much. So what I said in the beginning is this is a long haul, and we have to work a little bit harder than other people who are not in the medical fraternity. Hard work is the one which is going to give us good result, but this hard work has to be steady, continuous, and focused hard work. So you can do hard work intelligently, and you can do hard work without any planning. The second one will not give you good results. You will be doing lots of hard work, but result will not be there. But the first one will give you good result. So a little bit of planning, that is what we are discussing, from where to study, what to study, how to study, which parts to focus on, which parts to not focus on, and then the effort from your side. If you take all this knowledge and you don't put in the effort, then everything is waste. All this discussion, all this knowledge will go waste if you don't put in the hard work. Okay, so this information that we're discussing is important, but equally important is putting a small amount of hard work on a regular basis. So very quickly, I'll do the recap of what I told you. So first, the standard books which you can use to supplement what is being covered in the class based on your preference. There is no one correct answer. You can either use the book by Dr. Dinesh Puri, or you can use the book by Dr. Vasudevan. Some students like to use the Lippincott because of its flowcharts, but in the long term, it will not be very useful for you. It might be a shortcut for your exam, but it has limited information. And when you go to solving the questions, because it is a sort of summary sort of thing, sometimes the exact answer might not be there in the Lippincott. So Lippincott can be a good summary book, but it cannot be your main textbook. That is why I've not written the name of Lippincotts. Your reference book is definitely going to be Harper's, which is the one international reference book for medical biochemistry on which you have to focus. If you have any doubts, any queries, if it is not making sense, or if there is any conflict between what has been taught in the class, what you read in the book, then you can consider Harper's as the final authoritative comment. Whatever is written in the Harper, you can take it as a gospel. Okay, so that's part two. Part three is, please look at the previous year's papers and prepare your content accordingly. Whichever parts have been asked frequently, you have to make sure you know them very well. The parts which are not asked at all, or which have not been asked very frequently, they are less important. So you might still give some time to them, but they should not become your primary focus. Sometimes topics are very fascinating, but they might not be asked in your exam. So you can still read them. I'm not saying don't read them. You can still read them, but don't spend lots of time on that topic. Okay. And last thing I told you is the MCQs in both paper 1 and 2. You're going to have some MCQs, around 20 MCQs will be there in each of the papers. So it is very important to keep solving the MCQs simultaneously. Simultaneously, you should keep solving the MCQs. The trick to do all these things is listen to the lectures in the class, attend the early clinical exposure sessions, participate in the group discussions which are being conducted in your college, and at the end you can supplement all this information with the question bank that we have on our app. We are also gradually adding some videos for the UG content, for your syllabus content. So you can keep visiting the video section of the app also, where we'll be adding the content in the form of lectures. So if you're not happy with any lecture in your class, you have a second place from where you can try to understand the topic. I'll be covering all the important MBBS topics by a series of lectures. They are animated, and the animations exist in 3D. So it will be very easy to visualize when you see those videos that we are rolling out for you. A few demonstration videos are already out. About 6 to 8 videos from biochemistry are already there. So you can take a look, and you can understand how the videos will help your comprehension, because it is not just a single one-dimensional content which is being written. Whatever we are talking, we are showing in the form of a three-dimensional animation. So it is very, very easy to visualize if there is any reaction going on, if there's interaction between protein and the molecules, how the reaction is taking place, how the changes are taking place. So all of it becomes very, very easy to visualize. And this is not only for biochemistry. It is there for anatomy also, for physiology also. So it can be your one-stop reference for content, any content which you miss out in the class. Sometimes you might not be able to attend the lecture because of n number of reasons. Maybe you're not well, maybe you have had a certain emergency at home, or maybe you've taken a leave. So because of that, you might miss out on a lecture in the college. Now, the college lecture will not get repeated, but you can see the same lecture in your app on the DocTutorial in the UG content section, where we are going to be presenting you with the videos for all the topics in the MBBS. And not only the theory topics, we'll be recording and showcasing the practical work also. So the last part of your preparation for MBBS is the practical work. So please, please, please don't neglect the practical part, because you have to pass in both theory and practical with a minimum of 40% each. So minimum 40% in theory, minimum 40% in practical, average 50 in both. So even if you have overall 55, but in practical you have less than 40 marks, you will fail. So please note, you have to score a minimum 40% marks in the practical also. So practical work is equally important. Attend the practical sessions and try to perform the practicals diligently, because you generally don't get multiple times or the free lab time to do the practice. So do those practicals in the class, in the practical hall very well. Whatever doubts or queries you have, you can discuss and clarify with your faculty. If you miss out on any practical work, again, those practicals are recorded in your app. You can visit them there. You can see them. You can put the queries, and me and the other faculties are there to solve and sort out any queries that you have. We also have groups. And the WhatsApp groups are there where you can interact with us and roll out any queries that you have. Okay, so this is all the message that I have for you. Once again, welcome to the noble profession of being a doctor, and welcome to the medical fraternity. The way ahead a little bit tough, but if you are diligent and if you plan properly, then nobody can stop you. Last word, if you fail to plan, that means you plan to fail. So if you want to succeed in this profession, it is very, very important to not only do the hard work, but do a planning before you do the hard work. And this, what we discussed here, is part of that planning, how to focus your hard work that you're doing. And please don't forget that we are here to support you all the time throughout your career, not only in the first year, but even when you go to second year and third year and fourth year, and you're facing problems, whether they're academic or they're non-academic in nature, we are there to do the hand-holding for you. With this, I'll sign off. Thank you for joining, and best of luck. Bye-bye.